Well, in early pregnancy, let's say the commonest, not say complication, but a problem which does happen is hyperemesis or vomiting. So a woman who is not able to eat at all and is vomiting almost everything out, and she's become so dehydrated that she loses all her fluid and her nutrition becomes really bad, then in that case we definitely need to admit her. And so this is a minor complication, but it's very easily correctable. Okay, but the commonest thing which happens in pregnancy is bleeding. Okay, now bleeding is something which is very, very alarming for most patients, and in most cases, let's say the bleeding is never normal in a pregnancy, except for something known as an implantation bleed, which can happen at the time of the expected period. Say I'm expecting the period on a certain date, and then 2-3 days prior to that or a little after that, I may get some amount of bleeding, and that is known as implantation bleeding. That's usually very mild, lasts for about 1 or 2 days, and then it settles down by itself. But any other bleeding in pregnancy needs to be checked out or investigated. So you need to visit your doctor and check out what that is. But many times it is innocent. Sometimes it may mean that you have a higher chance of having a miscarriage. See, there are a lot of possible complications which can happen, but the common ones are again bleeding in pregnancy, okay, which can mean that your placenta is little low lying. The placenta which is there to supply blood to the baby, that usually is in the upper part of the uterus, but it can be a little on the lower side, and in that case you may get some bleeding. Okay, rarely there may be some complication known as abruptio placentae, which can be a very serious complication, but that's very unusual, so no need to worry on that. You can get high blood pressure in pregnancy, which is again fairly common. About 10% of first-time pregnant women may get that complication. Okay, then you have something known as premature birth, which everybody is quite familiar with, where you deliver the baby before the 9th month. It's not exactly 9th month, but nowadays again, because of good NICU care, you're able to save most of the babies even up to say as early as 28 weeks. A normal pregnancy lasts for about 40 weeks, but even as early as 28 weeks nowadays, with good and care, we are able to save the babies. So yeah, that's some of the complications. I mean, I can give you a huge expansive list, but these are the common ones. Yes. See, cramps is actually a feeling that you get, a feeling of heaviness or something which is pulling, and that is pretty normal in pregnancy. Especially in early pregnancy, what happens is that the blood flow increases towards the uterus and towards the lower abdominal organs or the pelvis in general. So most women are going to experience some degree of heaviness or pain during the first 2-3 months, and that is pretty normal. We get many times women who come and complain that doctor, I feel as if I'm going to get my period. I thought I was going to get my period, so I didn't do the pregnancy test, but many times it is an indicator that you are pregnant. The blood flow to the pelvis has increased, which is why you're feeling the heaviness and cramps. Bleeding anytime in pregnancy is not normal. There's only one exception to this rule, and that is known as implantation bleeding. Implantation bleeding happens only for a very short period. It is usually a very small amount of bleeding which happens at around the time of the expected period. So you think you're going to get your period, you get a little spotting, you feel yes, maybe I've got my period, maybe I've not, and then later on the bleeding stops, and if you do a pregnancy test after a few days, it's pregnancy positive. But at any other point of time you get bleeding in pregnancy, it needs to be investigated by a gynecologist. In early pregnancy, I can think of 2 common complications which can happen. One which is very, very common is excessive vomiting or hyperemesis, as we call it in the medical language. Now, hyperemesis can happen to any woman, especially women who carry twins or who have an abnormal kind of pregnancy, or even women who have a lot of acidity. It can happen. So in hyperemesis, the woman is vomiting so much that she is not able to take her normal intake, and she's vomiting out all her food, and then she's at a high risk of getting dehydration. So in which case we need to maybe admit her and give her IV fluids, etc. And then she usually settles down by about 3 months or so. The second complication, and the more dreaded one, of course, like we just discussed, is bleeding during pregnancy. So if you have bleeding during pregnancy, you need to investigate it. You need to see whether your baby is fine, the heartbeat is okay, the baby is growing or not, or sometimes it can indicate that you've had a possible miscarriage or you're about to miscarry, and then you may need treatment, bed rest, etc. In late pregnancy, I can give you a whole list of complications, but let me tell you a few very common ones which are which can happen. Like in our country, the commonest thing we find is anemia in pregnancy. Anemia is a condition where the woman's nutrition becomes bad. She has less iron in her body, so her hemoglobin goes down. Now this is something which is very common because our women still don't get that much of antenatal care. So, and that itself can cause many other complications. The other possibility is getting high blood pressure during pregnancy. High sugars, that is diabetes in pregnancy, can happen. These usually happen after the 6th or 7th month of pregnancy. Then premature birth is another possibility. Okay, and bleeding during late pregnancy, which can mean that you have your placenta maybe low lying. Placenta is the organ which supplies blood to the baby. It's usually situated in the upper part of the uterus. Sometimes if it is situated a little lower down, then you may get some bleeding. See, the best you can do is maintain your good health and hygiene and have regular antenatal visits with your doctor. Okay, and if everything is going normal, there are still some things you cannot prevent. See, for example, if you're going to develop high blood pressure in pregnancy, there is really nothing much that you can do about it. If you have a family history of diabetes and you are at a high risk of getting that, nothing you can do. But at least you can do regular visits where you can diagnose, and so that any complication which in the early stages you catch it, then you can manage the problem. Okay, premature birth means you are going to deliver before your due date. So you are 40 weeks is the complete gestational period, or what you say the duration of a normal pregnancy. Up to 37 weeks also if you deliver, that means 3 weeks before your due date, that is still quite acceptable. But if you deliver before that, we call that as premature delivery. Now the commonest cause for this in our country is again anemia. That is a predisposing factor. The woman is anemic, she has poor nutrition, because of which she is predisposed to getting that. But all said and done, the commonest reason for getting premature birth, or the woman who is at maximum risk for getting premature birth, is a woman who's had a previous history of premature delivery. So if she's had one premature delivery, she has a higher risk of getting that in the next pregnancy. Similarly, if she's had 2 premature deliveries, her risk for getting the next premature delivery is even higher. Then other than that, commonly infection of the uterus, infection of the vagina, those white discharge which is persistently there, or urinary tract infection, that is another common cause. Then if you have twin pregnancies or triplets, that the uterus is so big, so there's a lot of pressure on the cervix, and the cervix or the mouth of the uterus can open before time, so that is another cause. Sometimes you have excessive fluid in the uterus, so because of the excessive fluid, again there is more pressure and the baby can deliver prematurely. There are some conditions wherein we need to deliver the baby prematurely as doctors. Say for example, if the woman gets high blood pressure and because of that the baby is not growing well and the baby has some problem inside, then we decide to remove the baby early. So we are going to actually deliver the baby before time and cause a premature birth. So there are certain conditions where we need to go in and take out the baby. Signs of labor pain. Okay, the commonest sign that most women present with is pain. So it's like it may present, different women present differently. Somebody can come with say low back pain, and then they don't know whether pain is because of some other reason, overwork ki what, but low back pain in the lower abdomen or pelvis region. So it's usually the menstrual cramps pain. Wherever you get menstrual pain, that is where you usually get labor pain. So the pain may be behind, it may be in the front, or it may be coming from behind right into the front and going down towards the thighs or the vaginal area. Okay, the biggest hint that this is probably labor pain is that labor pain is almost always rhythmic, meaning it comes and it goes. It is never continuously there. So it will be there, then it will go, then again after maybe half an hour to 1 hour it will come. Then gradually over a period of time, the pain will come more and more frequently. So initially if it was coming every 1 hour, it will now come every half an hour, every 15 minutes, every 10 minutes, every 5 minutes, and the pain will become more and more severe. So this is how labor pain progresses. I usually tell my patients that if you start feeling this kind of rhythmic pain, and then if it's coming in every 5 to 10 minutes, then you know that this is the time to go to the hospital. Then the second common way in which women can present is leakage of fluid. So that means she loses all the fluid inside. So she can just suddenly rupture her bag, and she's standing somewhere sitting or whatever, and suddenly a lot of fluid just comes out. So that is known as rupture of membranes. The third presentation is some amount of mucus discharge which happens. Now this is something very confusing. Most of the women don't know whether it is significant, what is this really. Many times what happens is, this is the cervical plug is what we call it. The discharge is nothing but it's an exodus of the cervical plug which was covering the mouth of the uterus. So that gets released first, and then the mouth of the uterus starts opening. So once you get that discharge of the mucus plug, you don't know when labor will set in. It may take a few hours, it may not happen immediately also, but it usually heralds that. Many times this discharge is accompanied by some amount of bleeding, and that is known as show. Now if you have discharge plus bleeding, a little bit of blood streaked with it, you know it is show, and probably you will be going into labor in the next few hours or so. But again, there are no hard and fast rules about it. It again depends on every woman to woman. Usually first timers have a much longer labor duration. Now see, one thing, like you said, now most women are confused when to go to the hospital. So there is something known as a latent phase. Latent phase is when it is sort of a pre-labor or preparation for labor. So that phase can last from a few hours to a few days. Okay, so women are feeling the heaviness, pain, some discharge, but not sure. So latent phase is very variable in any woman. But once you go into proper labor, that means you're getting rhythmic contractions, at least 2 to 3 contractions every 10 minutes, then you know that you are in proper labor. And then most of the multi-gravidas, means who have delivered more than once before, these women are going to deliver within the next 6 hours usually. That's an average duration. And the primi-gravidas or the first timers will take about 12 hours, sometimes even 24. But in active labor is not usually more than 12 hours. See, the pain is needed. The pain is needed because it is the contraction of the uterus which is going to push the baby down. If you don't get the contraction, the baby is not going to get pushed down, the baby will not come out. But yes, we can definitely reduce the perception of pain by the woman. We can make her more comfortable. Okay, for that there are 2 ways. One thing is, of course, the woman, her own perception or her own constitution, how she feels about things. A woman who is very fearful, a woman who's got a lot of negative thoughts about pregnancy and she's very worried already, she's very anxious, then she's very likely to not be very positive towards labor pain. But if she's very confident, if she's attended maybe some classes, if she's very comfortable with her doctor, her environment, then she's probably going to be far more comfortable. But we can definitely make her medically more comfortable by giving her something known as analgesia or epidural analgesia. So what we do is we put in a needle into the back, through which we put in a small tube, and through that we inject certain drugs, and those drugs act on the uterus and the lower region, and they reduce the perception of pain. So the woman is not going to feel the pain, but the pains are going to come and go, and they are going to push the baby down. So she can definitely have a normal delivery also. And if God forbid she needs a caesarean section for any reason, then through that same tube we can inject a different dose of drugs, and we can do the caesarean section also, so she doesn't need another prick. See, now there are many indications. Now again, I'll list a few common ones. One common reason why we have to do caesarean is malpresentation. Malpresentation meaning the baby usually presents by the head, but in certain cases the baby may be presenting by the bottom, that is known as a breech delivery, or sometimes the baby may be transverse, adva what we call. So if the baby is going to be transverse, it cannot come down. So these are some common reasons. Then you can have placenta previa. What happens in placenta previa is that the placenta, which is supposed to be in the upper part of the uterus, is situated in the lower part of the uterus, because of which it blocks the passage of the baby. So baby cannot come down, because of which you may need to do a caesarean section. Sometimes the fluid in the uterus reduces, and it reduces to such an extent that the baby is not able to come down, or the baby may get distress. Distress meaning when the baby's uterus contracts, the baby's heartbeat goes down, and that indicates that the baby is having some kind of problem. And if we allow that condition to stay, then the baby may come out with less oxygenation in the brain, and then you get those babies who don't cry immediately after birth, or they may have some damage to the brain because of less oxygenation. So sometimes in such conditions also we need to deliver the baby by caesarean section. Okay, sometimes it happens that you have bleeding during labor, your placenta separates prematurely, so there is a lot of bleeding happening. Then to save the mother and baby, we may need to deliver the baby early. So these are some of the commonest causes. See, now most of the time let's say the Indian people are pretty good at taking care of themselves. In fact, they take far more care than what we would say. But I would say 2-3 basic points which need to be taken into account. One is that she needs to take more care of herself. See, she has to take care of a baby, but she has to first take care of herself. If she is not going to focus on her own sleep, her own health, she is not going to be able to handle herself. So after a normal delivery, what you should be doing is at least for 2 weeks you should be taking complete only time to yourself. It should not be doing any other work, any other household work at all. You should be doing only what is needed for yourself and just feeding your baby. That's it. Bathe every day, keep yourself very clean, clean your stitches if you have any. Okay, after every time you go to the washroom, you clean your stitches, you dry it up, and you apply an ointment whichever your doctor has prescribed. Okay, don't allow yourself to remain dirty. Okay, you have to take your daily bath. The one thing which I specifically tell women is definitely clean your breasts regularly, but don't keep on applying soap and water again and again before breastfeeding. That dries the nipples, which is not good. So what you do is just regular cleaning with water is more than enough, and you can apply some oil, some edible coconut oil, which is keeps the nipples soft, so that the breastfeeding is also very easy. Whenever you breastfeed, make yourself very, very comfortable. Don't feed in odd positions for very long hours. Take a good back rest. Have some relatives to support you and help you, so that you don't get tired and you don't get bad backaches. Okay, if you feel at any point of time that you're bleeding excessively, you feel that you're having any abnormal signs like headache, okay, or if you get fever especially, then you should definitely report to your doctor at any point of time. Exercise. Women are usually not very sure about when to begin exercise. I would say after a normal delivery, you can start exercising within a week. So it depends on your previous schedule and how comfortable you were, but I would definitely say that you should have a supervised exercise program. Don't start off by yourself. Walks, yes, you can start within a week by yourself. Gentle walks, then no high impact activity for at least 2 weeks after a normal delivery. But you go in with a proper fitness trainer, and then you gradually pick it up. So start gradual program of exercise and go on increasing it. See, after a cesarean, like any other operation, you have a wound which usually has a dressing by the time you go home. If it is a waterproof dressing, you can take a bath. Otherwise, your doctor will tell you not to take a bath till your stitches are out. Once your stitches are out, you're quite normal. One thing you should avoid is massage on the tummy. Okay, because massage on the tummy for a cesarean woman is definitely not okay, because it definitely puts a lot of pressure on the wound. Okay, if you have any kind of fever, pain at the stitches, you have to report to the doctor immediately. Otherwise, the rest of the things are same. But exercise, yes, you can start maybe 2 weeks after the cesarean, but again start very gradually. Start with walks, or with your previous schedule, you should maybe go down to about 20 to 25% of your previous schedule, and then gradually increase, and again only supervised. And then after 6 weeks or so of cesarean, you should you may be able to come back to your previous schedule of exercise. Okay, one thing is avoid outside food, junk food. Okay, avoid high impact activity, means jumping around or anything which gives jhatka, that kind of activity should be avoided. Okay, avoid traveling in very crowded places. Avoid wearing high heels. Okay, eat wholesome regular food. Indian regular foods are excellent, but homemade foods are the best. Okay, and you can have intercourse if you're comfortable. If you feel that no, you're getting some kind of pain or ever you get bleeding, you may have to stop intercourse, or at least you need to report to your doctor. Report any kind of abnormal discharge, white discharge. This is the commonest reason for getting infection and premature delivery. So any kind of discharge, urinary infection, you should report to the doctor immediately. Do your regular antenatal visits very, very religiously, because that is when we catch any problem which is just beginning to bud. Okay, if you get any kind of swelling in your feet, lie down, take a little bit of rest, and for about 10 to 15 minutes, you just take 2 pillows below your legs and you rest for some time. Don't sit down for too long with your legs hanging down, because then that fluid collects down and you may get more fluid collection, and that's not very comfortable. So for the backache thing which can happen for many women in pregnancy, avoid bending forwards. Avoid any kind of work which involves lifting heavy weights. So if you are washing clothes and jeans, pants and all that, and you're picking it out of water and doing that, that's definitely going to strain your back. See, if a woman is used to doing a certain amount of workout, her back is already strong, she's already used to that kind of activity, that's perfectly fine. She's probably going to be able to continue that kind of activity throughout a pregnancy. Usually we start all this kind of workout only in the 4th month or later, not before that. But then if you are used to it and you do it supervised under a trainer, it's perfectly fine. But if you're going to start out with something like this in pregnancy, so you already, pregnancy is going to take a toll, because in pregnancy your joints are a little loose because of hormonal effects. You have the abnormal weight in your body, okay, so your body is not completely balanced, and then at that point of time, if you're going to start some new exercise program, especially about weightlifting, then you may just strain your back or your knees, so that is not right. But you can, if you start a graduated exercise program under a specialist, that would be fine. No books that I would know of, but yes, Google, I think Google Baba is good enough. Find, connect, follow us on Medicalwale.com, आपके हेल्थ के साथी.